Association of Insurance Commissioners and to introduce you to the nation's insurance regulators. We share the administration's goal to extend coverage to millions of Americans not covered by a health plan and to make health insurance affordable for all. We pledge to work with the administration and members of Congress to find the best possible solution. Please join me in welcoming the Vice President of the United States of America, the Honorable Joe Biden.
I've never seen so many damn many insurance commissioners as I see today. You know, I'm really happy you're here this week. Your input in the process is literally, not figuratively, as I was saying to Roger in the back, is going to be key to the eventual success of healthcare reform. It's no coincidence that our Secretary of Health and Human Services, helping to lead the way on healthcare reform, was a former colleague of yours. You all know that it isn't just a crisis for people who don't have insurance. It's a crisis for many who do have insurance. And for many who have insurance, there is real, genuine insecurity. I want insurance companies to be able to provide a return on their investment and their stockholders to benefit. I want them to continue to do their job and make a profit. But I also want them held accountable. I want to restore stability in our healthcare system. And there are basic ground rules we need right now. One, no discrimination for pre-existing conditions. No exorbitant out-of-pocket expenses, deductible or copays. No cost sharing for preventive care. No dropping of coverage for the seriously ill. No gender discrimination. No annual lifetime caps on coverage. Extended coverage for young adults. Guaranteed insurance renewal. Right now, a company that may want to do, quote, the right thing cannot, quote, do the right thing, because they'll find themselves at a competitive disadvantage. But it is universally required of all those providing health insurance, there is no competitive disadvantage. According to a stark report issued last week at Harvard University, as many as 45,000 people per year die owing to a lack of health insurance. If we do nothing, in 10 years, 1 in every $5 Americans earn will be spent on health care. In 30 years, 1 out of every $3 will be spent on health care if we do not bend the cost curve. Right now, about 46% of health care is government funded through Medicare and Medicaid. I had a woman come up to me, God love her, a friend, and say, Joe, I want the federal government keeping your hands off of my Medicare. If we don't change this system, there is no reasonable prospect we can get our fiscal house in order. Doctors' organizations, nurses' organizations, hospitals' organizations, drug companies, they all support significant reform. And the traditional groups like seniors and labor unions and others, they continue to support reform. And of course, there's you, the insurance commissioners. I've read your statements. You support reform. I'm not tying you into our plan or any specific plan. But you know, this is no time to tinker. You support reform. You've said it in your healthcare reform principles. You said we need to protect consumers and increase the affordability and access to insurance. You all get it. You know better than almost anyone about the inefficiencies, the cost shifting, the bad practices that presently corrode our healthcare system. You know these reforms will only serve to strengthen the vital work that you do each and every day. You're the best equipped to educate consumers. You are the best equipped to field complaints. You're the best equipped to serve as a critical line of defense against the abuse and fraud that has crushed families, crushed businesses, and crushed the dreams of millions of Americans. And you'll remain so. Folks, the problem is real. The need for reform is acute. and the time is now. So thank you again, and may God bless you. May God bless America, and may He protect our troops. Thank you all very much.